without further ado, we're going to start with Dr. معاذ. Dr. معاذ الخنيزان, who is going to talk to us today about understanding caregiver culture characteristics in Saudi Arabia. Dr. معاذ الخنيزان is a consultant in geriatric medicine. He's currently working in King Faisal Specialist Hospital and Research Center. Dr. معاذ is a newcomer and a great new addition to the geriatric field here in Saudi Arabia, and we really hope that he's going to deliver an amazing lecture about understanding caregiver culture. Without further ado, please join me in welcoming Dr. معاذ. يعطيكم العافية.
Assalamu alaikum, masakum Allah bil khair. I'm really glad to be invited by the organizing committee to give this talk about an important topic that is often overlooked, which is the influence of culture on dementia care in Saudi Arabia. Okay, so these are going to be my objectives for today: how culture influenced dementia, Saudi demographics pyramid. I'm going to talk about the current knowledge of the cultural factors in Saudi Arabia and some future challenges in the field, and finally some recommendations for culturally appropriate care. So what is culture? Culture is a set of learned traditions and living styles shared by a member of any society. Culture influences how people think, how people perceive and define and respond to illnesses. Also, it can explain and shape some of the illness-related behaviors. Culture is a dynamic thing, and culture also continuously changing, and that is observed over time. Race is usually described as a genetic characteristic in the literature. However, when you look deeper into the literature, you will find that most of the racial groups are defined by societies and culture rather than genetics, which gives the weight for the culture influence on dementia and dementia care. Well-documented differences in the cognition processes across the various cultural groups is also observed. We have a different normative data in some of the neuropsychological testing as well. Even there is some anatomical differences in the brain activations reported in a different cultural groups when performing the same mathematical tasks. So what about the culture in Saudi Arabia? So little evidence is available, and there hasn't been a comprehensive study with a purpose and a direct purpose to describe characteristics of informal caregivers in Saudi Arabia. The main theme is a family-based caregiving, where caregivers are the main caregivers for the patients, and usually they are motivated by religious and cultural beliefs. Saudi Arabia has a low score on an individualism spectrum, which displays the country as a collectivist. It means that the culture is built around reciprocity of favors, support, obligations, personal relationships, and loyalty to the group in the family and extended relationship as well. The decision is often involve the perception of one's group orientation. So some of the Saudi studies with a primary purpose, something other than describing the caregivers, gave us some hints about and clues about the demographics characteristics of the caregivers in Saudi Arabia. Most consistently, caregivers factors in these studies are women, 50 years and less, caring for parents and has a university degree with low level of income and live with a care recipient. This is the demographic pyramids in our country, and you can see visually how it's changing over time. In 1980, you have a very youthful population, and now currently you can see most of the groups are middle-aged group, and this is historically in the history of Saudi Arabia and the recent history of Saudi Arabia, where people less than the age of 15, they are not a majority anymore in our country. So we are passing this big milestones in our demographics. People above the age of 60, they represent about 65% of the population. And in 250, those same age group, they would represent 25% of the population, which is more than 10 million people. And this aging, 2050 is actually not very far, because 1980 is far more than 2050. So we are approaching this aging population in our country, and there is many reasons for that. One of them is the life expectancy being increased, and the Saudi Vision 2030 is the target to reach 80 years, and currently we are around 75.5, and this is one of the contributing factors for aging population. Another important factor is the fertility rate, which again, you can see visually, it's been declining to a historical low point, around 2 births per woman in our country. And this is also largely contributing to an older population in our country. So what is the influence of culture on dementia? It has many influence on dementia on many levels and aspects throughout the journey of the patient. And even before that, in epidemiological point of view and research point of view, you can see in the literature, medical literature tends to pathologize the burden of care and frame it into psychological morbidity, obscuring and altering the view of important factors that is associated with our culture, or associated with our caregivers, like religious factors and background factors. So the burden of caregivers should be looked through the lens of culture and religious factors, because you can see in the literature as well, people have, in our country, they have high satisfaction, life satisfaction, at the same time they have high depression. It cannot, this combination of both can contradict each other, and a better understanding of those aspects would be really important. The research participation and representation by some of the groups can be altered and affected also by the culture. For example, patients who are illiterate, they might be excluded from some of the studies. Perception of the disease in Saudi Arabia about the symptoms, causes, risk factors, and stigma is low across many articles that is published. Several studies show that almost 50% of the public think that Alzheimer's is a part of normal aging. About also 30% of the society or caregivers that they were interviewed, they think that the society stigmatized people with dementia. So in a detection part of dementia also influenced again by culture. A lack of knowledge about dementia and services, as well as low health literacy, can be a barrier for help seeking for patients with dementia. Some answers to the questions about the person's cognition and person's physical functioning might be interpreted differently in a context of cultural and language backgrounds. So we can face this also in the clinics. Lack of access to a culturally sensitive assessment and diagnostic tools is a constant challenge in the practice. This is a visuospatial assessment part in the Arabic Monterial Cognitive Assessment. Many patients, cognitively intact, well-educated patients, sometimes they struggle to complete this task. I noticed that because mainly, if they are cognitively intact, obviously, there is we've been taught in the school that there is two ways of alphabetical sequence. You have الترتيب الأبجدي, which is أبجد هوز, and you have الترتيب الهجائي. So some patients, well-educated patients, they might struggle a little bit to complete this because they would think they should complete it in الترتيب الأبجدي, while in fact they should complete it in الترتيب الهجائي, for example. Another example from the same actually test where a camel being used as for a language assessment in naming, which is a high familiar animal in our culture. But in fact, the low familiar animal should be used for a language assessment and naming. And again, this shows how culture and the culture of your patients affect using some of the diagnostic tools, even validated diagnostic tools like Arabic MOCA. Some of the risk factors of dementia like diabetes, high blood pressure and depression and low level of education among older adults can be more frequent, and this also might influence some types of dementia as well. In the management, some of the healthcare providers can face ethical dilemmas which arise from cultural differences and misunderstandings. There are several studies in Saudi Arabia show that up to 70% of caregivers believe that it is safe for people with Alzheimer's disease to drive as long as they have a companion in the car at all times. This again has something to do with the cultural aspects where caregivers sometimes they don't want to upset their parents, and sometimes they might allow for some behaviors that might be risky. Many barriers for caregivers to seek support. Seeking support might be perceived as a refusal or a failure to accomplish their religious duty, and or lack of respect for elders, which can be in turn bringing shame to the family, and this is something we need to pay attention to. A majority of caregivers across several studies actually agree with the following statement, which the caregiver should take over right away when people with Alzheimer's disease begin to have difficulty taking care of themselves. And this is also can be explained from a religious and cultural point of view, where the concept of al-birr is there. Usually the concept of al-birr will make the threshold of taking over the task from the parents low, so compared to other culture, for example. But again, some of the things we face in the clinics when assessing to the function, even for cognitively intact patients, the level of function, many tasks that have been already taken over by the sons and daughters. But there are few tasks like prayer or performing of prayer, for example, nobody will take care of that. Usually the patients will do it themselves. So you should know the patient's culture and use that to help you to help the patient. A sandwich generation is a concept where a caregiver's taking care of their parents as well as their children. A vast majority of caregivers in Saudi Arabia have other family members in the house to take care of. Feminization of dementia care is a global theme, and several studies in Saudi Arabia, and actually almost all of the studies in Saudi Arabia, showed that it is also a common theme. Some of the studies actually mentioning up to 99% of caregivers are female. So what are the future challenges? So there are many challenges that we will face as a community, we will face as healthcare providers, and the caregivers themselves will face. There is a cultural shift in Saudi Arabia with the continuous changing of the demographics pattern. We are talking about urbanization, migration to big cities, increasing numbers of women pursuing tertiary education and ultimately participating in the workforce. So when we consider factors like economical circumstances and the lack or shortage of long-term care facilities in the country, as well as the increase of older adult proportion, we can anticipate and tell that there will be challenges along the way, and the traditional care that we are seeing, the arrangements will be changed sooner or later, and that's why we need to be barred to incorporate our cultural factors. Which leads to my last slide about the recommendations. And again, this is a time where we all, as advocates for our patients and for caregivers, to have an open discussions about how to move forward. So development of educational programs should be executed and expand the knowledge and decrease the undesired perceptions about Alzheimer's disease. Attention should be paid to the management of risk factors that is common in our countries. More research is needed to adapt and develop more culturally appropriate assessment tools and diagnostic tools. Also a call for policymakers and shareholders to invest in a full range dementia care facilities with a special attention to our cultural factors and incorporate that into this change. Thank you.